And this will be sent out sometime over the next few days. So if you want to go back and reference anything that's covered during today's presentation, feel free to do so. Also attached to that recording is a quick questionnaire. We value your feedback, so we want to make sure that, one, you're heard, and if you have any feedback for us as far as the presentation, recommendations, we take that into consideration. So please make sure you're taking the time to fill that out. It should take you no more than 2 minutes, just a few questions. The chat feature is open, so if you do want to ask any questions, you certainly can use the chat to ask questions. We will have a designated Q&A at the end of the session. So if you want to hold off on questions until the end, you can certainly do that. I'd probably recommend that just so that we're not going back and forth and stopping the presentation. But if there is something pressing, feel free to post that into the chat. And then, like I said, at the end, the Q&A, and I'll actually allow people to take themselves off mute. And if you want to come off mute and ask your question, or if you want to post that into the chat, you certainly can do so. And then from here, what I'm going to do is I'm going to pass it over to our presenter. Alex, are you ready to go?
Yes, I am.
Awesome. So if you want to share your screen.
Yes. Sorry, just 1 second. Are you guys seeing my screen?
I don't see anything yet.
You don't see anything. Okay, shoot. Sorry about that. Give me 1 moment. Okay.
Now we can.
Okay, perfect. Sorry about that, guys. Thanks for joining today. We are going to be talking about healthcare employment trends in the coming years and where will we be. So I do have, like RJ said, a question and answer section at the end, but feel free to put in the chat if you have any questions, let me know. Go ahead and get started. So what has changed? Workplace safety is one of them. There's the fear healthcare workers are afraid of COVID, afraid of being labeled a villain, or just burnt out, by the more than usual exhaustion of wearing PPE and having long shifts. Mental health awareness too. The pandemic has shed light on the importance of mental health. There's a growing recognition for the need of mental health support and services, both in person and through telehealth. Technology, the virtual patient care and virtual classrooms is something new that we saw. And staffing, we had healthcare workforce challenges, strained healthcare workers, leading to burnout, contract labor, layoffs and closures. Safety, so studies indicate that 44% of nurses experienced physical violence and 68% reported experiencing verbal abuse during the COVID-19 pandemic. The healthcare and social service industries experience the highest rates of injuries caused by workplace violence, and these workers are 5 times as likely to suffer a workplace violence injury than workers overall. So we did create the workplace violence education consultant position. This is a full-time position that is staffed by a counselor, and it goes across all different chains of leadership. So this involves staff that are working bedside all the way to our executives that are working with some policy change too. In addition, Trinity Health built into our electronic medical record a risk scoring tool that allows for early identification, continuous awareness, and communication about high risk of violence patients. I did want to mention too, you guys will see QR codes in the bottom right of these slides. If you are ever interested or you want to learn more, you can go to that QR code. It'll take you to our website. Feel free to explore there or scan it and look for later. So telehealth virtual care, the COVID-19 pandemic accelerated the adoption of telehealth and telemedicine. Patients can now receive medical consultations and treatment remotely, reducing the need for in-person visits. This shift has improved access to care, especially in rural areas. It also helped with staffing support and safe ratios for nurses. So, telehealth and telemedicine, I'm sure some of us have experienced this as patients as well. Just that new virtual care that everybody had to implement pretty quickly, and more remote positions that are available for nurses. Digital health records, we've transitioned quite a bit of that over to all of our health records over to digital. We recently just switched over to Epic, which most of you guys might be familiar with. And that was a really smooth transition for us. We've had a lot of great responses from that too. And then virtual connected care. So this is a newer staffing model that we are practicing. It is consists of a bedside RN, a virtual RN, and then an RN partner like a nursing assistant, or nurse apprentice, certified nursing assistant, LPN. Um, what this does is that it allows us to have higher patient to staff ratios, but at the same time keep it really comfortable and really safe. So we piloted this in other ministries across Trinity Health, who owns us, and they had great success with it. They had really good responses from the nurses that were working this, as well as the supporting staff. What this looks like is that in one area of the hospital, we will have nurses that are having they have access to these screens and virtual care. The cameras can see all the way to the barcode um, on the patient's wristband. They can see IV ports, and that helps. It's in another part of the hospital, so it's not completely remote. So it does still help support, but on a different kind of level that is helping us embrace technology. Oops, sorry, guys.
Hang tight, everyone. It looks like Alex accidentally X'd out of the session. So hang tight, we'll get her back in and she will continue on the presentation.
Oh, I have the power to unmute myself now.
You are good now.
I saw Alex pop off of there and thought, classic technical issues. So yeah, I'm curious if anybody does have any questions. I'm the lead over our nurse recruitment team, so I work really closely with the different units that are hiring. Hopefully, have a little bit of helpful insight, and I'm happy to answer questions that may have come up.
And I will actually, if anybody wants to jump off mute and ask questions, you can certainly do that, or you can post them right into the chat.
Hi, my name is Olfalia, and I actually have a quick question. So I am a change in industries. I have intensive customer service experience and business kind of business atmospheric experience, but I'm trying to find move into because I am doing my bachelor's in healthcare management right now. And I'm trying to move into, the healthcare industry. I'm having such a tough time, with it because I mean, I know I don't have the healthcare background, but I do have the essentials, um, the business atmosphere and administrative atmosphere that I know that, and I mean, I can pretty well transition into it, but I'm just having a hard time even getting somebody to interview me.
I'm curious, when you look at what you're wanting to do you have a specific area, or is it more, you want to be within that like administrative influence, versus like a really, so like, for example, certain parts of healthcare administration, you have to have a clinical background to get into. So it's more difficult to get in at a certain level if you don't already have experience as a nurse or physician, or I don't know, any other kind of clinical role. There's other pockets like patient advocacy, or we have a pocket within our organization that does care management, utilization, and stuff. And that can be, I'll use easier in quotations because there's a lot of other variables. So when you think about what you want to do and how you want to apply that existing skill set, what is that? Is it super targeted, or is it pretty broad for you?
Well, I've seen, or I've tried to apply to the patient advocacies, and in those I guess lower roles on it, just to get my experience on the healthcare. But no one's calling me to even interview.
Having any luck with it?
Exactly. Yeah.
It's hard to say because there are a lot of variables, and it'll depend a lot on everything from and I know you guys, I'm assuming the folks on this call are like nationwide. You're probably not all in my backyard here in Idaho. So if that assumption is correct, then there would be a lot of variables for whatever your local, industry, economy, whatever looks like in terms of hiring competition. But I'm wondering, anytime it's a complete shift for a person in career focus, it's definitely an extra barrier because people's brains are lazy and they just look for like the words that they want to see. They want to, if I want to hire somebody, of course, my default is I want to hire somebody who fits the cookie cutter that I've put up in my brain. So a lot of times there's maybe some creative work that needs to happen on the resume to try to hook people in a little earlier. It's a complicated question and probably not a very concise answer. However, I would be more than happy if you want to either drop it in chat, or we can go through the host. Is it David that's the host? I'm sorry, I didn't write it down. To get me your email address, because I'd love to look at your resume and look at kind of what your goals are and see if there's anything like up front that I could point out as an idea. It's just individualized enough. I hate to give you a pat answer that's like, well, try this sentence and it will make a world of difference, because it's hard to know.
I appreciate it, and I'm here in well, I'm in Nampa.
Are you really?
Yeah.
Awesome. I am too. I wasn't
cool.
sure. I jumped on to support this call at the last minute and was like, well, I can't remember where everyone in the class is at. Oh, and Courtney's in California, which California is like it's a whole other ball of wax just from an employment perspective in general. Yeah, changing industries. So that actually sparks another question. So for each of you, how many of you have a clinical background, or like what degrees are you working on? Is it all healthcare administration? Are any of you doing like a associates to bachelor's RN program, or what's the degree focus for you?
This is David. I'm seeking a healthcare information management degree.
Okay. On the informatics side then, am I understanding that right? Or okay.
Yeah. Yes.
Okay. HR management. Awesome. And then master's in healthcare admin. Okay. Yeah, talk about a broad cross section. So, boy, it's complicated. I'm obviously more familiar with my local market, but I would say broadly. So, Courtney, where you're in California, what are you going? Oh, you're going for HR management, and then yeah, within healthcare. Are you wanting to stay in California, or are you open to looking elsewhere?
I'm open to looking elsewhere, but my family's here, so I think I'll be in California for a while.
Yeah. Healthcare usually, it's really easy to get into if you have a clinical background for that broad cross section, right? Like we're always hiring nurses and physicians, but then there's other pockets that are more difficult. And for healthcare administration, I will say for people wanting to break into it. If you don't already have a background in healthcare, then there's definitely a little bit more deliberate strategy that would need to be applied on the front end to try to build those connections earlier on. I'm like, I don't want to go down a rabbit trail and talk too long, only because I could do it easily and I don't want to waste your time though. Let me see if Alex is going to be able to rejoin. And then if she's not, we can kind of make this a little bit more casual since it's a smaller group. Honestly, maybe it would be more helpful for us to round robin a little bit. Because I can talk with each of you about some of the areas that you're most interested in, but are there broader questions that that you may want to know about either our organization or healthcare in general that would be helpful?
That certainly works if we want to, if Alex is not able to rejoin us. I think that would be fantastic.
Okay. All right, I don't see anything back from her, so let me keep an eye on the clock. And David, feel free to rein me in. Since I'm not relying on PowerPoint presentation, you guys are getting the unfiltered version and presentation from Saint Alphonsus. So let me start with the top first. For those of you who are looking to maybe completely change industries or looking into the clinical realm for the first time, how many of you are on the call today because you're looking for opportunities and want to know really like what St. Alphonsus and Trinity has to offer? I know that that's always like a recruiter's motivation to join, right? But at the same time, if you guys are just curious to know more about healthcare industry opportunities on a broader scale, then I'm happy to talk from a bigger picture perspective as well.
And feel free, if you want to come off mute, you can come off mute, ask any questions, or make any comments.
This is David. By the way, RJ is the host, not David.
Oh, sorry, David. I'm picking on you for helping me out.
David, if you certainly want to host, be my guest.
I'll share my story briefly. So I actually have a long history in healthcare. I'm on the older side and never actually obtained my degree. So I'm just basically getting my degree for the first time. Even though I've attended university for like 3+ years, I just never wrapped it up. But I actually have worked in the business development side of healthcare for about 30 years, of which 10 of which was with a healthcare IT company. So I'm actually looking for a new role, and I'm actually facing too much experience. I have too much experience for the roles I'm applying for, and so I'm not getting a lot of interviews or calls because I have too much experience. I actually chopped off the first 15 years of my experience off my resume because I think people they're not looking for somebody as experienced as me is my impression. So I don't know, in your role, where's that line, I guess, between hiring somebody who has some experience that you want to develop, their career versus somebody who has a lot of experience? How do you view that or look at that?
So there's two different lenses, and the challenge you're going to run into is that, of course, every company you apply for, the recruiter whose resume your desk crossed, or even hiring manager, sometimes, it might be the manager who's making that judgment call. They're going to be looking at it from a different lens. In general, I'll say that on the recruiting side, myself and all my peers have not just the training, but the experience to not dismiss somebody who looks on paper like they're overqualified. So I don't know that on the recruitment side that would be the factor. Although anything is certainly possible depending on the, the organization and what their processes are. If anything, so here's where I have to try to be like both candid and also keep in mind that things are different, because I know for myself, my goal in those scenarios is to understand somebody's motivation for applying for something, regardless of their level of experience, and give them a chance to make their case for why they think they're a good fit for the job. So, in your situation, I don't know if you have applied with a lot of companies where it's a large company, there's like an online system, you never really talk with the person. And so all you're going by is that you're not getting that opportunity to speak, in which case, I'm wondering if there may be an opportunity on resumes to try to address the elephant in the room up front, like having a statement about what your motivation is in applying for the job, to keep the other party from making any assumptions. Most people that I work with would value the experience. Now, if you were, a physician applying for a janitorial job, I'd probably want to talk to that person just because I'd be so curious as to why. Those type of significant gaps make sense to me, that somebody would immediately go, well, no, they applied for the wrong job. But yeah, typically having too much experience is not an issue. Not that it's never an issue, but it's not actually that common. So
Yeah, it's been a little befuddling because the roles I've been applying for, there's certain, they have requirements and things. It's usually, 5 to 10 years experience or something like
right.
that. And I have more than that. So I'm thinking, why wouldn't they want to talk with me when I,
Yeah.
meet the requirements? I know they get a lot of applicants too, so it's very competitive. So
The number of applicants an issue, and like one of the things that I would say for anyone, regardless of what you are, like what your focus is or what you're wanting to do, if you're, in a situation where you're applying and you're not hearing back, and you've done like the first step of just looking at what they're looking for and what you have to offer, and is it easy to make a correlation on paper? If those are all the case, if that's the case, and there's nothing glaring on your side that you can think, wow, maybe I should have done better on this, I think your best bet, and maybe it's a hard one, but it's to try to track down somebody in that organization, preferably in recruiting, who will respond to you. I mean, a good recruiter will respond. Maybe it takes them a couple of days. Um, Maybe they don't, but I will tell you, like with the team I work for, I think 80% of us, even if I don't have time to give somebody an in-depth explanation, I'll at least acknowledge a message and try to make that connection. And so, I mean, the biggest challenge in recruiting is that a lot of times we're not responsive. And I use we broadly because I know we try to be much better about that here, but it's a big barrier across the board for candidates who aren't getting the feedback. So I don't know how helpful that is. I'm sorry.
that's helpful. Thank you. And I'll let others chime in. I don't want to hog all the time. I will just say that I've had business dealings with Saint Alphonsus, and I know Courtney said she's at Sutter. I've had business dealings at Sutter too. So anyway, I know right where you guys are at.
Good. Okay, I'm going to go back to chat and see if there's anything there. Challenges of the healthcare industry, where it's headed, and things to know. Yeah, in the bigger picture. So, sorry, I just got a message from Alex. Let me ping her back. She's still having some tech issues, so you guys are stuck with me. So this is easier for me to talk about. Local market challenges, just some things that we're seeing. Specifically for St. Alphonsus and the area that we're at, it's kind of a unique market because we're kind of in the middle of a desert. It might be high desert, but it's a desert. When you look geographically around us, there's not a huge pool of talent to pull from. And so our market tends to be more of a challenge because there's just not enough people locally. So we routinely recruit in, especially for clinical positions. For other positions, there is a bit more of a glut on the market, I suppose. So like, for example, in the administration side of things, and I use that word broader, like HR, marketing, all of those functions, there's lots of talent within that arena, but specifically within healthcare, it's harder. We are also locally in an interesting situation where we're one of two major healthcare providers in the Valley. We are nonprofit, faith-based. They are not for profit, I think is their status. And I always jokingly say it's like we're the two football teams that are constantly at rivalry with each other and always trying to be competitive in the same way. And that's not sustainable when it comes to trying to be best in class, because you're just always trying to one up each other, and it's difficult to try to play that game. So we've really tried to focus and differentiate based on our faith-based identity and the type of work that we provide that way. From one of the things that I think Alex had touched on briefly before her connection dropped was this virtual care model that we have. I know this isn't the brand new concept. I know it's happened or it's been rolled out in other organizations, but it's been really fascinating to see how it has played out here, because the staffing challenges that we have means that we simply do not have enough nurses to fully staff every bed that we have available. And so this care model puts virtual nurses in the patient's room with using standard technology to be able to not only address some of their really basic questions or needs, but also to be next to the nurse at the bedside and provide coaching or training or a second opinion as needed. So it does enable us to be more creative in how we staff. What's interesting is, you know, the virtual component, they still need to work on site. That's something where we're having a lot of dialogue about in this world where remote opportunities are so popular. How do you strike the balance of, you know, having somebody available locally, but work remote versus working remote on the other, you know, side of the country. So let's see, remote opportunities to overcome location barrier. So I don't know if what I spoke to is more specific to, I think, the clinical side, but in terms of other remote opportunities, are you talking, let me scroll up, sorry. I think I rolled over the question there. So I guess, Eugene, do you mean kind of what I was just referring to, like with on the clinical side or more on the administrative side for remote opportunities?
I guess more of like the not in the clinical aspect of it.
Yeah. I will say that we've been more open to remote than ever. So I do happen to live in Idaho. I work from home, clearly. But we have people within HR and marketing who live across the country and work remotely. I will say specifically for Saint Alphonsus that COVID really pushed us into being a little bit more open to that. Previously, it was not something that was ever really even championed, whereas now we're seeing the benefits of it. And so I do think that those opportunities are going to continue to come. It's just going to unfortunately be highly individualized, and it will really depend because I think certain positions are much easier to do remotely. Well, many are easy to do remotely, but some you really can't be as effective as if you also have a connection locally. So I feel like it's a very generic answer, but at the same time, it's true.
I'm back on. I'm so sorry, you guys. I don't know how long I was talking to myself. When did what slide did I leave off on?
I think you were just talking about Together Team virtual stuff when you logged off, but we've been having a pretty good conversation, hopefully at least somewhat helpful to some folks that we've talked about a few different topics.
Okay, great. All right, so I went 5 other slides alone. Let me share my presentation. I'm so sorry, you guys. I didn't even know I got kicked out.
Courtney, I'm going to make a note of your question and we can come back to that because in terms of things like, salary and sign-on bonuses, I definitely have some insight that I can share with you guys on what we've been looking at and offering.
Is this the slide that we left off on?
I think so. I think you were at
Okay.
the end of it, but I think.
Okay, yes. So virtual connected care, the Together team, I'm sure Kayla's had time to kind of walk you through too what that looks like, but it's something we've been implementing that's really helped with our staffing ratios to be able to help more patients while still having a really comfortable and safe environment for our colleagues and our patients too, of course. So our staffing is a balance, just like any market. People's priorities have changed. So folks are looking for part-time PRN or sometimes just altogether leaving the healthcare industry. Unfortunately, with the toll that it took on healthcare workers such as yourselves, it's a lot. People experience burnout, they experience mental health crises, and we're seeing a lot of early retirement too. But because of that, employers have had to react and had to give out more incentives and adapt to changing needs. I think listening to our colleagues, we've been able to make the biggest changes that we see the impact from. Monetary updates, we've reconstructed our compensation package that doesn't only include wage increases, but we also restructured our referral program. So anybody that refers an RN, for example, and they get hired, they get $5,000 for that hire, and they can refer as many people as they want. If they refer somebody who is not an RN, let's say they are environmental services or food services or respiratory therapist or a CST, they get $2,000 for that. And there's no cap on that. One of our nurses that started last year, she's made $35,000 just in referrals on top of her additional salary. And we also have some non-monetary incentives, of course. It's more than just offering a raise. It's really being there for our staff. And something that I've seen our president, Odette Bolano, she's also a nurse herself, rounding on units and talking with staff. And our staff really feels comfortable, regardless of the unit, to be open and transparent, to say, these are the things I'm struggling with. These are the things I'd like to see changed. These are the things that I'm needing personally as an individual. And she takes that back, and not only her, but all of our executive team and our leadership, all the way cascaded down to unit managers. They've had a big focus on listening. Just listening, I think, is the biggest thing. And what do our staff need? They have to be able to, feel comfortable and feel supported in the ways that they need at work. So we are seeing a decrease at the height of the pandemic. The demand for temporary short-term nurses was significant, nurses and supporting staff. Now, 3 years later, it's starting to taper off by almost 40% in some of our departments. We don't expect travel nursing or travel work to completely dissipate, of course, but we are seeing it go back to pre-pandemic times. One thing that we've worked on, this actually was implemented before COVID. So it's First Choice. It's our internal staffing solution. And I'm not sure if Kayla got the chance to talk with you guys about this, but this is something we're really proud of at Trinity Health. It offers nurses and other support staff, like imaging and respiratory therapists, to be able to travel within a more structured system and still be a colleague somewhere. So you're not working for an agency, you're working within Trinity Health. So you can work nationally, do it from one ministry to the next. You can work here in Boise at Saint Alphonsus, or you can work over in New York or in Fresno, California at St. Agnes. You can also choose to work regionally as well if you're not wanting to travel as far. And some people love that flexibility with having their families here in the area. They want to be able to have the flexibility of having the assignments and enjoy, that premium pay without having the instability that can come with working with an agency. We also have a lot of support too for First Choice. So we have First Choice, representatives at each ministry. You have leaders that you can go to, contacts that you can email. We make those resources really available to you, so you never feel like you're not a colleague as part of Trinity Health or part of the ministry that you're working at. But this has been really helpful. We've had a lot of travelers convert from agency over to First Choice because they're not quite yet ready to get rid of that, let go of that travel kind of lifestyle, or, I mean, let's be honest, the travel paycheck. So the First Choice model is something that's not going away. Like I said, it was there before COVID, before the pandemic even sprouted. And so this is something that's going to continue to stay. So here is some interesting statistics. Moving forward, projections indicate that there's going to be approximately 200,000 openings for registered nurses each year over the next decade. So job security for sure. It's one easy way to say it. We know that contract labor ebbs and flows. So the opportunity for medical imaging and other technical spaces, kind of like I was mentioning, outside of nursing, they're also available for travel. And like I just said, there's always going to be a need, but we are going to see it come back to where it was pre-pandemic, especially as other healthcare ministries like ourselves are adapting to using, embracing technology, and how do we make that a better colleague and patient experience and use it to be safer, more effective, and just overall improve quality care. So we're seeing 15% of registered nurses, a vacancy rate right now across the industry, and as high as 21% vacancy rate for home care nurses. More than 40% of active physicians in the US are going to be 65 years of age or older in the next decade, and approximately 20% of registered nurses are projected to leave the healthcare workforce by 2027. In addition, 92% of nursing homes and 70% of assisted living centers report significant or severe workforce shortages. So this is something, like I said, the healthcare industry is seeing industry-wide. Some ministries are seeing it worse than others, but at Saint Alphonsus and at Trinity Health, really having that support, we don't feel disconnected to Trinity. Pretty much everyone at Saint Al's feels part of that Trinity family. So I'll just speak, I guess, from that Trinity perspective. At Trinity Health as a larger health system, we're very aware of this. And so this is something that our executives and all the way down to our unit leadership is really working forward. We don't want there to be, any surprises or any units to suffer, any like short staffing or anything like that when we are able to see what's going to happen. So retention has been probably the biggest impact that we've been able to make. Just like I said, listening, what do our colleagues need? What is our staff wanting? And that's a great representation too of just healthcare nationwide, listening to our colleagues. And so that helps us make some decisions in moving forward, in addition to some of the things like technology, improving workplace safety, supporting mental health awareness for people. So this is something we're very aware of, and it has a big impact on the decisions that we make as a ministry. Can you still hear me, Kayla?
Yep, I can hear, and well, I can't see you, but I can see your presentation. So
okay, perfect. Oops. My mouse is doing weird things. Sorry if I get stuck for a minute. Hold on, guys. Sorry.
are there any questions? Oh, wait, nope, there it goes.
There we go. Okay. So where will we be? Speaking from St. Alphonsus and Trinity Health, expanding services. So this is something that, we really like to make aware to the masses because it's something that we're proud of. And although we're trying to focus on retention and staffing and, really trying to keep our units feeling comforted and feeling supported, we're also growing still. So we never stopped with that. We just opened Idaho's first neurosurgical trauma ICU unit. This opened recently this year, and it's been incredible. You saw, or you didn't see because I played the video before I realized I got kicked off, but you'll see Shelby, who is a neurosurgical trauma ICU nurse, talk in a couple slides here and share her experience. That's just one example of the services that we're trying to offer to serve our communities better. We're in southern Idaho, so I don't know how many of you guys are in that area or familiar with it, but it's kind of a desert. We're kind of a little oasis in the Treasure Valley here. So we are a level 2 trauma center, the highest level designation in Idaho. So we serve Idaho, Eastern Oregon, and Northern Nevada in the communities that we serve. And so the amount of services that we can offer and higher level of care that we can offer to those communities for support, it just makes us all the more better. And that's really what we're here to do, is, you know, to serve people. So like I said, we're listening. We really invest too in internal promotion. So Jacob, an RN here, he was in our CVICU for a couple of years. He's now promoted to a leadership oversight role. He's just one of the many success stories that we have of people that come here. They truly see the culture, because everybody says they have great culture. You know, everybody talks about how internal culture is the number one thing. And we are constantly trying to find a way to explain this to people that haven't worked at St. Al's and that aren't a part of it. But it's different here. Everybody looks up and smiles and says hi when you're walking through the hallway, regardless of it's your first day or you've been there for years and you know everybody on the floor. And with that, we see people wanting to stay, and we see people developing, because we create that environment that's really nurturing for somebody who's wanting to grow professionally. We support with tuition reimbursement, which is, you know, one of the other bubbles right there, education. We offer the upfront colleague tuition scholarship. That just requires, all we ask is 1 year of working with us, but we pay for your schooling right up front. So it's never something that you have to pay for and then be reimbursed for later. And that's working with a couple schools in our area to be able to offer that. And then our unit leaders to support with scheduling. So what do you need? Do you need to be part-time? Do you need to be PRN? You know, do you need days, nights? How can we work with you? Because not only do we want to see you grow, because that fills our cup as well, but we want you to be successful with the resources that we provide too. So technology, I've mentioned it a few times in the presentation, but we're really bringing that in and constantly thinking, what can we do next? How do we stay on the cutting edge of healthcare? And right now, a lot of that is in technology and AI. And so we're looking on a broader scale within Trinity Health of how do we make that a part of our everyday patient care, and to really support our colleagues. Number one, how do they feel that it's making them better, making them quicker, more efficient, safer? And so that's something that's continuously part of the conversation. And then preparation too. So we saw struggles with supply chain through the pandemic. Some health systems worse than others. I think being a part of Trinity Health was really supportive for us in that, because we had a larger organization that was able to help out and provide resources. But making sure that we're fairly stocked on supplies, we have a good relationship with the supply chain, with our supply providers, and watching expiration dates too. So investing in things that have a longer expiration date so that we're able to keep them longer. We really want to make sure, I mean, we fared pretty well through the pandemic. Everybody had their struggles, of course. But we're really proud as an organization to be able to be where we're at. And so preparation is just going to continue to make us successful and make our colleagues feel taken care of and safe if anything like the COVID-19 pandemic were to ever happen again. I guess I can stop here. Does anybody have any questions? Anything coming up in chat?
I saw one question from Jennifer that I could speak to, which you had asked about, you know, if you have clinical experience, like even a more entry-level clinical position, like a certified medical assistant, help with transitioning into healthcare along with a master's. So it could, but also and I hate to say this, but it's so true. It really depends. So like the example that I'm thinking of is if I have somebody who's graduated and they have their master's in healthcare administration and they're applying for a position like, I'll say clinic manager because it's just popping off the top of my head. If all they had was the education but no practical experience, I don't think that they would most likely be successful. But if they have the education, previous leadership experience, whether it's in healthcare or not, and then some type of experience like as an MA that you noted, that helps bring together all those puzzle pieces. But then there will be other positions where the minimum qualification is a clinical licensure. And so the job postings and the information the organization puts out should clearly specify if that's a requirement. But I don't know, hopefully that helps give some insight. It's really, if a license isn't required, then the question is how translatable is your experience? So I hope that helps. Yeah.
Awesome. All right, let's see if my mouse will work. There we go. So how can candidates get ahead? Don't underestimate soft skills. So soft skills being, bedside manner, communication skills, and I think too worth mentioning mental health, understanding of your own mental health and how do you need to be supported. I don't know if I'd consider it a soft skill because it is so big and so important to the overall balance of who you are as a person and a colleague, but being able to speak to, what, again, like what I just said, what support do you need? I think that's important too, to be able to bring to a team and bring to your leadership, because it shows that, you've taken that seriously. And that's something that everybody, regardless of whether it's, mental health crisis or you haven't been through one, how do you support yourself in that? And how can we support you in supporting yourself? So investing in continuous education and certifications, as you all are right now, like we've kind of mentioned, we support that. We do also have continuous learning on the units too. So it's not just going to a university and furthering your degree that way, but there's other ways to get more certifications in your specialty and become more specialized. So then another one here is go to work for an organization and stay. This is more of a traditional kind of view, and this is some feedback that we got from our leaders when we were building this presentation. I think one thing that we are proud of at Saint Alphonsus is our retention, and what we like to see from our staff and what we really encourage too and create the environment where people feel safe enough to do this is to be transparent. And if there's something that's not working for you, because you have to find the right fit. If it's not the right unit, it's not the right shift, it's not the right leader, whatever it is, how do you come forward and say, this is what I need help on? I know we've all heard of the term quiet quitting. And sometimes, especially if you just recently started, it's easy to just say, never mind, this isn't working. There's 500 other jobs that I can take. At St. Alphonsus, we really do view every single person as an individual and a big part of our team. And so when we say go to work for an organization and stay, what I really like to rephrase that as just putting that, and I don't even want to say putting that effort in, but just being true to yourself and what do you need as a colleague. I think being able to exercise that, I think at least at St. Alphonsus, it's something that we commend and we take very seriously. So in terms of retention, if it's somewhere that you want it to work out, we'll make it work out for you. So this is Shelby. She is an ICU, NEST ICU, so neurosurgical trauma ICU unit. I'm sorry, it's ICU registered nurse. So I'll go ahead and play the video. Let me know if this is choppy. If it is, I can just pause it and we'll send it out so that you guys can watch this. We've got tons of videos like this of our colleagues, our leaders, anybody that, we have such a great culture here. And I hate to say that because everybody says that, but we truly do. And so we're always trying to figure out, how do we tell people that? How do we show people that? Here's just one video of Shelby, she's amazing. I'll just let her speak for herself, but let me know if it glitches.
My name is Shelby Bodine. I'm a nurse apprentice, and I've been at Saint Al since May of 2022, so a little over a year.
Is that going okay?
It looks like the audio's clear. It's not lined up with the video perfectly, but as long as the audio stays aligned, we can always squint and ignore the video.
Okay. I'll let it play, but sorry for that. I'll just know that we'll have this sent out so you can watch this in better viewing conditions. But here.
I chose to stay at Saint Alphonsus because it was really hard to turn down a beautiful and unique unit such as the Nest. I knew from the very beginning that I wanted to be an ICU nurse, and I knew that there wasn't a better opportunity other than to come to the Nest. And I applied early on because my love of neuro took me to our old unit, which was the neurosciences floor. I ended up loving that unit so much that the transition to the Nest was seamless. I knew exactly that I wanted to go there. I knew exactly that's where I wanted to build and start my career as a critical care nurse. I love the opportunities that have been presented, the people I've met, my coworkers. I absolutely could not have done this without them, and they are a massive reason why I chose to stay with the Nest. I can't imagine doing this with anybody else. My love for critical care nursing came from the idea that I'm an intense person, and I really like thinking on my feet. I thrive under pressure. I like high stress situations. Some of the harder conversations in critical care are ones that I'm actually very passionate about. End of life care is one that I'm very passionate about, and organ donation, and that's things that we see a lot in the critical care aspect. Bringing in the trauma component to this new unit was really, really, really impressive, and I didn't really fully grasp what that was going to end up looking like. What I did end up finding out was my love for trauma is very, very, very intense, and it's the perfect fit for somebody who likes an intense lifestyle, spending a lot of time outdoors, running, fishing, hiking, climbing mountains. I just feel like there is a certain aspect to people who like to live their life intensely. Growing up in this valley, I always remember driving past the towers, you know, here in Boise, and always thinking it'd be kind of cool to work there. And now I work here and I get to really serve the community that I've just always has just been such a huge part of my life. St. Al's has such a fixture in the community that when someone asks you where you work, you can say with pride, I work at St. Alphonsus in the Nest. You know, the neuro and surgical trauma ICU and step down is the new shiny thing that we get to talk about a lot, but it's because it's so exciting. And there's so much pride that I have when I get to say that I transition over into this new role with something as incredible as the Nest. And you never walk into a room in the Nest and feel like you're not a part of a team. So it's hard not to come to work and be motivated to do better, to learn more, to gain more experiences, and to continue building the presence that is the Nest in this valley. My name is Shelby Bodine. I'm a nurse.
Sorry. So, like I said, I'll send that back out, but the neurosurgical trauma ICU unit is just one service that we expanded. You know, some other areas that are important right now too, that are very heightened, lab and respiratory. We saw the need for that explode. Primary care is growing, preventative care. So, you know, we're seeing also too in the med surg and the acute care space, the need for more nurses. So we're adopting, like I said, we're bringing our how can we make our colleagues feel successful, and how do we still grow as an organization? And so I believe we've been successful so far with that, but it's a process. So I'd like to invite any more questions. Thank you again, Caleb, for taking the reins for 20 minutes or so while I was talking to myself. But what other questions can we answer for you guys?
As people are coming up with some additional questions, just a reminder that this was recorded. So if you want to go back and reference anything that was covered by Alex or Kayla, you can certainly do so in that recording. So keep an eye out for that coming out in the next couple of days. And if you do have questions, feel free to post them in the chat or come off mute and ask them.
Just saw, excuse me, I just saw Courtney's question about any roles or departments that are forecasted or predicted to have an increased need. So yes, and it kind of, I'm sure it will depend a little bit from area to area. So from a big picture perspective, the family practice / outpatient realm is we have seen extreme growth and expect to continue to see extreme growth because there is so much more of a focus on preventative care, catching situations early on so that treatment doesn't have to be as advanced. And so as much of that care that we can provide outside of a traditional inpatient environment, usually it's more affordable, and also just better long term. On the clinical side, I think almost any clinical position we are anticipating to have a greater need for. Nurses is one we talk about a lot, but actually another area I have seen a lot of growth in is our imaging space. So positions like radiologists, what are they called? Certified, they're CT techs, and I can't remember the full title for that. But interestingly, that field is almost as difficult to staff as nursing. It's just a smaller percentage of jobs, but the complicating part of it is, or the lack of staff is still as significant. There's another area that's slipping my mind. So if I think of it, I will, I send it in a follow-up, but it's essentially in the realm of, I want to call it care coordination, but it's a little bit broader than that. It's that intersection of where healthcare organizations, employers, and insurance companies come together and trying to have relationships and programs in place to help care for the patients in the most effective way. So there's a myriad of jobs. It's hard to list out like the specific positions themselves, but from a strategy perspective, that's definitely, I've seen some exciting work happening. And I know that there's continued focus on trying to develop that to improve outcomes. So hopefully that helps a little bit, Courtney. And then Ophelia, I'm happy to, I'll put my email address in chat, but we can also in the follow-up, make sure that we get contact information out to everybody as well.
That contact information I'll also attach to the recording of the session. And Alex, if you could send me that video, I'll also attach that video to the communication out as well.
Absolutely. Thanks, RJ. I appreciate it.
We have about 1 minute. So if anybody does have any last questions, feel free. But I do want to say thank you to both Alex and Kayla. We really appreciate you taking the time to jump in, speak to our WGU populations and those who attended. We greatly appreciate that, and hopefully everybody got something out of the session that they can take away and utilize moving forward. Any last questions?
Thank you, everyone.
Yeah, thank you for having us. We really appreciate being able to do this. Thanks for your patience with our technical difficulties.
Awesome. All right, so I'm actually going to stop the recording, and hopefully everybody has a great rest of your day. Take care.
Thanks, everyone.